here to this country, what they call illegally. So we're undocumented, we're going to school, we don't really get citizenship. We don't, well now certain states get financial aid, but not really for students going to school. But one of the big things that, that kept coming up was, that undocumented people are totally left out of the picture. Even though they thought they were gonna get, we got all worried because they're like, oh, if you don't get it, you're gonna get fined. And one of the things like, oh, you don't qualify. So in states where there's like a big undocumented population, you're not gonna get it. And if they try to get it through like private companies, it's gonna be like cost you like an arm and a leg. So they just not even gonna try. But other things that we heard in the interviews was that the lack of outreach to people of color, to the point where like they had to call them out and be like, you need to go and outreach to folks of color, to disparities with language. Another thing, just people didn't have access to it because it was not in English, or it was not in their language, which could have been something else, So I've heard a lot of things.
The Latino Caucus in California called out the outreach efforts in order to force them to increase outreach to Latinos.
And even when they created a phone line for people to have access to do that, massive amounts of ineffective help. They're sitting on phones for 5 hours waiting for someone to help translate because there's not enough people, not enough resources to help with these people who legitimately want to get this health care, have the rights, have the eligibility, but don't have access because of language barriers.
So,
Gary, are these cumulative figures, or is it that number of $1 billion lost in 2022?
No,
the way it reads, it acts like that's what it's saying will happen in the year 2022. And if it's a cumulative figure for 8 years, Texas is going to lose way more than 9.5 billion.
No.
Is that just that year?
Just that year.
Because that's part of the problem right here, is you have politicians trying to hold on in these kinds of states with changing demographics. For example, in Georgia now, the white registration has gone from 72 to 59%. So in 8 years, you're a Republican governor in Georgia, you're betting maybe it could be down to only 50% white registration. So if you've got to hold on to your votes now, you don't necessarily, that's $3 billion some other joker will leave with term limits or whatever. You're not going to be facing that election. Let somebody else have to deal with that. So simple math is dangerous on this too. Pass this to Chaco.
I have a question.
Go.
I feel like we had talked about how the Affordable Health Care Act doesn't address like the issues of like the stress of racism and the all it addresses is the one little slice of disparities because it doesn't have an analysis of race. And then also that there's reluctance to pass by conservative legislators to just pass the Health Care Act as it is. Like, how do those things go together? Or like, is there a danger in it passing?
Is there a danger in the act passing?
I guess a danger in, so obviously there's more people covered, which is good, but like, then healthcare is fixed in the public discussion, or I don't know.
Well, there are a couple things. One, there are mandates within the act. For instance, every state is mandated to address disparities. I mean, that's part of, and there's and to do a report around how they deal with disparities. Every state is mandated to actually have a wellness plan, which would mean that you're not just forcing people to take pills. You're supposed to actually expose people to alternative, what they call health modalities, which might mean acupuncture or chiropractic or meditation, whatever. And it ain't done. It simply ain't done. They're simply ignoring that. The other thing which is something I did not expect to find because I didn't know anything about this, is the reimbursement rates. The reimbursement rates for, in rural areas, for instance, you don't have big institutions that are providing health care. What you have are individual practitioners. Individual practitioners on the tier of reimbursement get the lowest reimbursement rates. So, for instance, I interviewed the president of the Black doctors, the National Black Doctors Association, who happens to live in Oakland, and what he expressed were a couple things. One, that in Oakland, even though the rates in California have been bumped up for 2 years for individual providers, they haven't been paid in 5 months. So they're docs who are serving poor people who are running their practices on credit cards. So there's big institutions and the big medical groups are who counties are contracting with to be the insurers of record, and individual practitioners are being squeezed out. And I'm not necessarily saying that I think any doc is great or anything. But I am saying that what they've done is they've created a system where only big institutions operate at an advantage, and smaller practitioners, which have traditionally given better care or more individual care, are being squeezed out unless they join some of the bigger institutions. So there's lots of...
Well, there's about to be a huge shoe that could fall. Of 10 million new registrations on affordable care, they're now challenging almost 3 million as potentially having discrepancies in their applications on the income test involved, which trigger the subsidies. What do you think those 3 million, almost a third of the new registrations, are going to be? Where their income, disconnects on the application. Those are going to disproportionately, obviously, be low-income people, and if they're disproportionately low-income people, that's going to be disproportionately brown, black, whatever. So, of all the new registrations, you could have a third of them kicked out because essentially their applications are now not going to be processed so that they can actually access the care. Now, that doesn't say that some of the things Gary says aren't true. I mean, you are pre-existing conditions, you now can't be blocked from insurance. I mean, there are some things that you mandate the physical, and there are other things that are very valid on this. But there's nothing but fight left in the Affordable Care Act.
And it's a dance because one pressure we've sort of been dealing with is people are saying, well, you're not going to say anything bad about the Affordable Care Act because that would harm Obama, and the right will use whatever you find to attack Obama. Well, the other side of it is there's lots of problems. And so how do you sort of speak the truth
Without giving them
about what's going on, and really give people some ammunition to be able to sort of move forward and address some of these problems. You've got to figure out what your political priorities are.
The biggest organizing handle that looks like it could break open for us is what you see. The only consensus is right now in changing for the good a problem with Affordable Care is the problem of out-of-network doctors. So to the degree you can align our constituency's interest with the fact that people are complaining because they thought their doctors were going to be part of it, and then somebody switched the bean on them and they bought that policy and it didn't turn out they were covered. So now in urban areas like New Orleans or Oakland or wherever we're talking about, you have to include 30% of all medical professionals within a 5-mile area. Well, the insurance companies are going to fight to narrow, to move the number of professionals that you can get service from to a smaller and smaller base. Customers, clients, all of us are going to want more and more people because you want access to your neighborhood clinic, you want to go to the clinic, you want to go wherever your doctor or your, GYN or whoever it is you like. You want to expand the network, they want to shrink it essentially to move people to basically be payroll. And there, I think there's an organizing issue. Clearly, they're breaking on that in a way that Democrats and Republicans aren't breaking around other healthcare issues. If we can identify those alignments, we might be able to win some. If anybody is interested in winning these campaigns. Huh?
If anyone's interested in winning.
Yeah, you never know.
There are, one of the things we're looking for in various states, what are some of the things that they've done that they, that have been good? So, for instance, in both New York and California, they've figured out a way to pre-qualify undocumented people for emergency care. So, if people go into a hospital, they can get care immediately without going through the how are you going to pay thing, which is the standard rap that people get. So that's a goodie. New York has also allocated money around housing. And there's a good argument to be made that that medical treatment is more effective to people who actually have a place to live, and that's been a long and interesting fight that they actually won that, and there have been some other kinds of things. There's a small business. Small businesses are the only entities that actually can register mixed status families without a hassle. And one of the groups that we work with is the Main Street Alliance. Fought for and got that in the act. So there are some holes. I'm not going to pretend that there's a solution to this, but I do continue to think that to not have an analysis of the way things work racially puts all of us at a disadvantage. People with good intentions, don't understand how race operates. Therefore, they don't deal with the implications of making certain kinds of decisions. And people who are, who don't care about people of color, it works for them because the system is set up for them.
And before I go, can I say something for those of us who are?
We're all going to go at 9.
I'm sorry. For those of us who are in Louisiana, there was a policy just passed that if you're pregnant and you go into the doctor and you say something like, "Oh my God, I just smoked weed or whatever, how's it going to affect my baby?" Now you have to be reported to the police. So, FYI, tell all your friends that do not ask those questions when they go to the doctor. Google it. Because there's another thing that the nurses do not report it. They're mandated to ask, and if they don't report it, they can be fined individually up to $10,000. So I just.
Well, we always learn something new at these dialogues. I missed that one.
Yeah, you'll have your baby in jail. And like Alabama just arrested their first mother who used drugs. But if a lot of women, especially, tend to, if they just find out they're pregnant, they'll be like, "Oh, I did X, Y, and Z. Is this going to affect my baby?" That is not a good question to ask anymore, because if you did X, Y, and Z and you are pregnant,
That is definitely a race-driven issue. That's bogus.
you will be reported to the police and you can go to jail.
Well, it also just criminalizes women, but
Yeah.
it's a pretty broad problem. Well, I don't know how to go in there, but in terms of organizing issues where you can find other alignment, one of the things that's required in companies is that all insurance has to be the same. So you can't offer a different package of insurance for the top executive than you offer to the bottom wage worker making minimum wage. So the problem on the mandate for some of these huge companies, particularly in the service sector and low-wage healthcare, like home health care companies, mental health companies, nursing homes, or whatever, is that they're now trying to get the cheapest coverage they can, which means high deductibles, low monthly payments. Because to be an affordable, a quality health plan to qualify, you can't have the premium, the monthly premium, be more than 9.5% of the gross that worker makes. So many of the companies where we represent the workers, they might have had a health policy, but the health policy meant a worker might be making $9 an hour, that's 18,000 plus, less than 20,000, but the healthcare premium might have been $300 a month if they wanted to be covered. So nobody was covered, other than those people, if you knew you were going for heart surgery, you got your ass covered because you were working for your insurance. Well, now they've lowered all these policies, and some of the companies we represent are big national companies with 50 and 100,000 workers. They've lowered all the monthly premium to get in below that 9.5% by January. But there is no provision of the Affordable Care Act that limits the level of deductible. So these deductibles for these low monthly payments are sometimes $5 and $6 grand. So the insurance sucks. And when you're at the bargaining table, what you find out is the guy who's from HR, the lawyer across the table, works the company, on the side they'll tell you, I hate this insurance. I'm having to put, to keep my job, I'm having to put my kids, this insurance sucks. And they're powerless, but, there's a break point there. There aren't a whole lot of them who are going to be willing to continue working for these companies. One thing is screw all the wage workers. There's another thing, if you can't get any middle management, any supervisors, any of the CEOs with this kind of health care, because you can't have a separate policy.
You can't have a separate, like you have to stay within your company's insurance, like you can't just go privately.
Well, you can,
Instead
on
of
your own
going-
money.
You can supplement with your own money.
Yeah, on your own money you
Well,
can, but the
people
company
who are
can't pay
earners-
for you.
Yeah, like so the people who are earning more money don't even care because they're.
Well, yeah, I guess if you're making, $10 million a year and you're running Goldman Sachs, yeah, you can get whatever you want. But if you're
You weren't using your insurance.
a lawyer, if you're a staff lawyer or somebody, you're not necessarily, you're making more than $9 an hour, but you're not making necessarily enough that you feel like making another $10,000 for better health care because you're getting an individual policy for you and your,
Yeah.
husband, spouse, 3 kids, 2 kids, whatever. So, but that's it. How can you end up claiming people have insurance who have a deductible where you're making $20,000, you have to spend $5,000 before you get the first benefit other than the package of things you get as a mandatory part of the.
I get a lot.
Let me ask you a question. If I would become employed now, would they have to give me health insurance, or would I still have to wait until open season?
Well, it depends on when and what kind of company you went to work for, because the president has put off the mandatory things for companies that have over 50 employees for another year. So, many employers aren't facing mandatory health minimums yet.
Does that mean the workers over the summer you don't get on health care or just do without?
If you live in Louisiana, as long as your governor doesn't expand Medicare, no matter what you make, if you're within what you would get because you're too poor and what you would get from your company, you just don't have insurance now. Unless you, pay an arm and a leg.
I've been hearing a lot of monthly insurance rates of over $1,000 for families, and it's crazy. And sometimes rates are shooting up like 50%. People are saying they're paying $500, not paying $800 a month. But apparently, their deductibles are through the roof now. Crazy. It's crazy.
I do think there's at least a temporary sort of coalition around small health providers and consumers on this, because I think the deductible question looms large, but so does the question of the reimbursement rate for individual providers. I think looms large as well. And politically, it seems to me we gotta face the fact that there is some credibility. Docs, whether we like them or not, they got some credibility, and a lot of the individual providers are pissed off.
Well, they'll get paid long before they lower the deductibles.
Hmm?
The providers will get paid long before they lower the deductibles.
Could be.
Yeah, they'll get paid. I mean, they'll fix that problem long before they reduce, say the deductible. In Massachusetts, when mandatory insurance came in, the limit on the deductible was put at $2,000. We didn't get that in the Affordable Care Act. So to the degree you looked at Massachusetts as the model, there's a big fight there. They were able to win the $2,000 cap on deductibles so that janitors, you know, food service workers or whatever, when they got the insurance program with the low, they couldn't, the deductible wasn't going to be over $2,000. Yeah, that hurts you if you're making 20 grand and spending $2,000 before you get insurance, but not the way 5,000 does. That's a quarter of your goddamn income. If you excuse my language here, but you know, this is an issue.
I think we'll use
Well, it's on the tape. It's on the tape. Well, you know, but whatever. I mean, that's a problem. We still, you know, and people haven't focused on that because so much of the delays, a lot of people don't realize the full implications of what's going to happen when these companies are forced to provide it. When they aren't forced to provide it, you can go to the marketplace, you can get a subsidy if you're only making that amount of money to pay your children, and you might be paying nothing for health insurance. Once that mandate comes in, and you're working for that same nursing home company, and it's got 100,000 employees around the country, and this is what your policy is, you can go to the marketplace, but you don't get any subsidies and you don't get any cost sharing. So you're just make it out there, get insurance, just like Joe Smo, just like, you know, our big CEO, and you and I were just talking about a second ago, yeah, you can go buy insurance, but you're going to pay $250 a month, or you're going to pay whatever insurance costs at the marketplace without the subsidy. With the subsidies and cost sharing, this has been a program that's allowed 10 million people to sign up. I mean, where we ran the outreach in Texas, Louisiana, and Arkansas in partnership with Sun, I mean, people were jumping. They couldn't believe the subsidies you should get.
If they got told about it, which that was the other thing that when we talked with people, some people were told about subsidies and some people weren't. And that had to do with race and language. So.
And I don't know enough about how it worked outside the system, but in Arkansas, where there was expanded Medicaid, they literally sent a letter to everyone who was eligible and told them, we expanded health care. And you know, you and I have been through direct mailing over the years, 70% return on that mail. You had to get back to them if you were interested. Boom, people were interested. Now, following up and getting to people, and now when they can't advertise, they can't do this, that, and the other to help recruit. And, you know, they're calling us in Arkansas, can you get the word out? No, we can't all of a sudden take up, you had 1,000 navigators, we had 10. You won't know, we can do it? Shoot, that's not the way it works. Well, we're moving down to the end. Gary, you know, I told you could talk about anything you wanted. This has been different. Now, there must be some other questions or comments. Anybody have anything else we haven't covered? What kind of health system do they have in Argentina?
There is a private, a private health system which is popular among people that can afford it, and there is the obligation of your employer to give you a health insurance coverage, and there's also a big network of public hospitals and public health insurance, and public hospitals are very crowded, and it's the service that they provide is worse obviously than the private ones, but you don't have to pay anything, like literally nothing, almost nothing, like equivalent to 50 cents of a dollar to get, I don't know, to see a dentist or.
But on the other hand, one of the most interesting organizing drives I've ever been a part of is a coalition with people who wanted transplants in Argentina, because the transplantes weren't covered by the public system. So if you need a new kidney, gee, you can get that. So you'd have these incredible meetings, because we are in coalitions with the doctors when we first opened, and organizing with others. So you know, people be desperate, life or death, you can imagine. You gotta have it, and how you get the rights, how you force a hospital to be willing to do those for you, regardless of income. The doctors were great, incidentally.
Right.
But they were unionized, so they didn't care. Yeah, we'll go with you.
Everyone is unionized. in
Yeah, I love it.
Argentina.
I love Argentina.
But I'm not sure about the transplants in
Well, this was 10 years ago, so I don't
I
know.
think because there is a phenomenon that a lot of people from border countries like Chile and Bolivia and Paraguay come to Argentina to get health care because it's cheap and it's better than what they had in their countries. And there's also
So that's
the
health
active-
tourism from the Southern Cone, huh?
Yeah. There's also the active policy of healthcare providers not asking your immigration status. Like any person can come to the hospital and they don't ask for your papers or anything. And if they do, they that's illegal. So they might get sued or yeah.
Wow.
Well, this has been great. So next month, there's going to be another dialogue. We have a visiting professor from Scotland who's studied community development in the UK, India, and elsewhere, who's going to be talking about housing, health, and other issues. And I think that's, maybe, yeah, it's in the 20s of August. If anybody signed the attendance list, we put out a bulletin on the first of every month that says what the calendar is, what music groups are coming through, if there's going to be a dialogue, who it is, if there's going to be something interesting happening. Gary, thanks a million for being my guest. It usually takes our volunteer, a week or so to put this on YouTube, but once it is, anything you thought, well, what did they really say? You can live through this 90 minutes of things, and thanks to you for the camera work. Okay? Appreciate your attendance. That wasn't bad, huh?
Do we I turn this off.
Yeah.
Is this the red button?
Yeah.